kinds of food that may be unavailable because of some outbreaks at certain facilities. But I want to be clear. Our grocers and our wholesalers have told us there is no threat to our overall food system. Food is plentiful. It will come to the grocery stores and you will be able to access that food for the foreseeable future, so there is no reason to be concerned about that. Second, for those people who are food insecure, our community has stepped up. Our community is meeting the demand and meeting the need for our community today, and they will be able to do so for the foreseeable future. Yes, there has been an increased demand. Just this past week, the YMCA, the City of Memphis, Shelby County Schools, Shelby County fed over 39,000 meals to families who needed it through our food distribution program. Just last week, the Memphis Food Bank had 45 pantries, and they served over 11,000 families with boxes of food that will last them for up to 2 weeks. We remain about 30 days out with our ability to continue to meet that demand, and the donations continue to come in. I will say that the food bank will welcome your donations every day of the week. So please, if you think you have some ability to give, please give to the food bank. Finally, we also know that families who are food insecure may have pets that have needs. Together, we as a community have come together, and there is also a pet food bank that you can access starting on Monday morning. And what they will do is, if you call this number, 636-1418, I believe it's on your screen right now, you can access the Mid-South Pet Food Bank. They will take a very quick survey. If they don't answer the phone, leave a message. They will call you back. They just want to know what kind of pets, what size, what breed, so they can provide the appropriate food for your animal. We don't want anybody to have to give up their animal just because they can't afford to have pet food. Finally, a pitch for additional contributions to the Regional Response Fund at the Community Foundation of Greater Memphis. So far, we've raised more than $1.5 million. Every dollar counts. So if you feel compelled to help your neighbors, that is one great way to do that, to contribute to the Regional Response Fund. I'll now turn it over to David Sweat with the Health Department.
Thank you and good afternoon. David Sweat with the Shelby County Health Department, Epidemiology. And just want to go over some of the numbers for you again today, as we do each time we meet. We have reported for this county 1,508 confirmed cases of COVID-19 since March 7th. We've unfortunately experienced 32 deaths so far, and we have tested 15,667 people for COVID-19 in our various test sites and hospitals and doctors' offices. For the state of Tennessee, 6,779 cases were reported as of yesterday afternoon at 2 p.m. I'm sure that will be updated again today. Tipton County had reported 53 cases in Tennessee, and also DeSoto County has eclipsed 200 cases in Mississippi. Crittenden County, Arkansas, 122 reported cases as of yesterday afternoon. The Shelby County Health Department is working with 7 different assisted living facilities and nursing homes in the county that have multiple or clusters of cases among either residents and or staff. And we will continue to do so. We're also working with Tennessee Department of Health Healthcare Associated Infections programs to make sure those facilities have all the information and resources that they need to implement the infection control practices that are necessary to control the spread of virus in those settings. I do want to talk a little bit today about mortality data, and we are probably going to do this every Thursday afternoon. Every week. We'll do this at least once a week, probably on Thursdays. And when we look at our fatality data, we continue to see, and hopefully you're seeing this on your screen at this time, we continue to see disparate impacts on our African American population. 75% of those who have died have been among our African American residents. By sex, we do see that males have a disproportionate impact. Fatalities, 62% of the cases are among men that have died. And then when we look at the exposure routes that have been documented for the fatal cases, we see that over half acquired their infection from close contact with another person who was shedding COVID-19 virus. We see that about 26, almost 27% of the exposures occurred in healthcare settings, and that would include in nursing homes and assisted living facilities, hospitals, doctors' offices, and et cetera. And then about 20% of the cases at this time remain travel associated. In the early days of the epidemic, all of our cases were travel associated, and we continue to see that that is an important part of the routes of transmission. As far as comorbidities, underlying comorbidities among those who have experienced fatality, 80+% of the people who died had a cardiac condition. They either had a high blood pressure, atrial fibrillation, congestive heart failure, some sort of valve problem, but they had a version of heart disease, some sort of heart disease issue going on. We see that more than almost a third of them had diabetes, and obesity and respiratory conditions that were underlying conditions are also important contributors. So the takeaways from these signals would emphasize once again that if you are, our median age of death is 67 years old. So we know that there is a disproportionate risk for those who are older. And if you have these kinds of underlying conditions, we would ask you to strictly adhere to all of the shelter in place and safer at home recommendations. When you do have to go out, please make sure you're wearing a mask, and please wash your hands as frequently as you can, and also use hand sanitizer when you cannot wash your hands. If you have others who can make non-essential trips for you, or even do the essential shopping for groceries or running out to the pharmacy to get your medication refills or things like that, if you have someone else who is lower risk, who can do those kinds of errands for you, that is really recommended if you have these underlying conditions. Now, before I open it up for questions, I also want to address for a minute the issue of youth or children and the impact of COVID-19 on our pediatric populations. So at the health department, we've been able to analyze data on this issue for the first 1,177 cases that have been reported, and we're happy to say that out of that number, only 19 truly pediatric cases have been reported so far, and that represents 1.6% of the cases. And when I say truly pediatric, I mean individuals who are less than 18 years of age. But what we see in all of our signals, whether we're looking at our signals among children, our signals among cases reported overall, and our mortality data, we see the disproportionate impact on our African American community. 68% of children who have been diagnosed with COVID-19 are African American children. 71% of all the cases who have been diagnosed in Shelby County with COVID-19 are African American residents. And as I said earlier, 75% of the mortality is occurring there as well. So for all these reasons, we want to just make sure that everybody understands that the measures that we can take everywhere in our community among all our populations will work to continue flattening the curve, continue reducing the impacts, and making it less likely that somebody could acquire the virus. But we especially want to draw attention for those in vulnerable populations, those with poor access to health care, those with underlying conditions. Please take all the precautions that you can. And at this point, I will open it up for questions. Any of us can answer questions that you may have.
Bradley Broders, Bradley Broders, Local Memphis 24.
Thank you, everyone. Thank you, everyone. Mr. Sweat, have there been any new assisted living facilities that have emerged? That's my first question. New cases since yesterday. I know there are now 7 such facilities. And Mayor Harris, I think you had mentioned this on Tuesday. Are there any plans to do any kind of executive order kind of specifically towards the centers? And I'm sorry, just kind of part of that, what kind of challenges is it? Are you noticing any differences in the PPE supply for those facilities? Because obviously we talk about the hospital workers, we talk about the first responders, but considering how much interaction and touching people are doing with some of these older residents, what kind of is there any concern there?
Since it's been a few days since I was at the press briefing, I'm not sure which facilities have already been discussed with you. All of the facilities on the list are facilities I've been aware of for several days and we've been working with as a team, so I don't believe there are any new ones. As far as the process of assisting them, it's multi-layered. When we hear the first evidence that there may be an issue in any of these facilities, our first outreach is with the Tennessee Department of Health Healthcare Associated Infections Program. And we immediately connect the leadership in the facility with the infection control specialists with the Tennessee Department of Health to make sure all the guidance that they need, all the recommendations that they're made aware of all the recommendations and guidance that exists from CDC and TDH on how to control the spread of the virus in these facilities. But then the next layer is, as we do our case investigations, our teams from the health department work with the facilities, and we also use a CDC assessment tool. And we take the facility through all of the questions on the assessment tool just to verify the different dates that they put different control measures into place, re-emphasize the recommendations and guidance that they've received. But as part of that assessment, we do ask questions about their supply of PPE. And then if we discover that they do not have all the PPE they need, one of the first things we do is look to our stockpiles within the health department and the joint task force and start making sure that until they have their supplier of PPE identified and sufficient resources on order, that whatever we can give them from our stockpile that they need in order to implement the guidance they've been given, we deliver that to those facilities. So that is a big part of what we do. And then we continue to work with the facility from that point forward on surveillance and monitoring to see if there are new ill individuals and what steps might need to be taken additionally after that. So that's a long-winded answer, but the short answer is that if we find that a facility needs PPE, we work to try to get that PPE to them as efficiently as we can.
Greg Coy, Fox 13.
Good morning, gentlemen. Question to Mayor Lee Harris. There was some concern among some people that while there may be new testing sites available and opened up, the issue is transportation, getting people to those sites. Is there a plan in place to address that need?
So I'll actually, that's an operational question. And yes, I think we are on the path, and I'll let Doug respond a little bit to that. If I could go back for just a second to the last question from Brad, because I think he gave us an opportunity to remind folks that we collect a lot of data around this issue, and the data is driving our action. So that is to say that the health department has done a really great job of compiling an extensive data report that they issue every day to the public across many, many variables. And that data has signaled to all of us that nursing homes are a particularly vulnerable community and that we're going to have to be particularly aggressive in order to protect residents of those nursing homes. And so we continue to try to articulate policies to protect those residents. And so the health directive that's in place now, for example, pays special attention to nursing homes and has things that require all nursing homes to bar visitors, that nursing homes must adhere to social distancing guidelines, that nursing homes must check temperature and forbid people with fevers from entering the nursing homes, and that all nursing homes must take extraordinary procedures to promote sanitization at those nursing homes. At the same time, David reminds us that the data is now suggesting that there's a disproportionate impact for minority communities, and so that has also led to actions of all of us. So when I renew the executive order, just to give an example, for Shelby County tomorrow, that executive order will have special emphasis around that new finding. That is to say that that executive order will now require all healthcare organizations that do testing to collect racial data and other demographic data so we can tell whether or not additional resources need to be devoted to communities that could be disproportionately impacted. So that'll be in the executive order that I'll renew tomorrow, and that will last for 7 days. A hard requirement that data around race must be collected so that we can get a fuller picture, understand how to devote resources, understand how to shape our messages and our public policy to protect communities that may really require severe treatment if they contract COVID-19. With that, I'll invite Doug to talk about transportation.
Yes. Thank you, Greg. The answer to the question is yes. The timing of that will be no later than Monday. We should have that available. And the process is that this is a collaboration between the individuals who are coordinating the testing across so many sites. We have an individual who is leading that effort for us, and we understood that transportation was a challenge. MATA has risen to the occasion, as they do so many times. They have pivoted. They did not have a vehicle that was appropriate to the purpose, so they've actually taken the task of modifying several of their vehicles so that the driver can stay in one specific isolated site, and the patient who believes they may be symptomatic can alight into the vehicle, be transported to the drive-through testing center, and be tested and then delivered back home. And the vehicle that can then be sanitized and ready for the next delivery. This is the capacity that we believe to start will be about 15 passengers per day. We think that's a good start on meeting that demand for people who are transportation challenged, and is a good example of collaboration between the drive-through testing sites and our transportation leadership.
Michaela Watts with the Commercial Appeal.
Hello, hey, can you guys hear me?
Yes, go ahead.
Okay, great. Thank you so much for taking my question. I have one question and a follow-up. I appreciate the health department's transparency on updating the media with the numbers of those affected by COVID-19 and those who have passed away from COVID-19 in our senior living facilities. But I have to wonder, can we count on the same type of transparency when it comes to other residential places? For example, prisons, our county jails, or even perhaps group homes that house youth. I guess in essence, what I'm asking is, can we expect the same type of updates?
At the health department, of course, we're always balancing several different key principles. And the first principle is that we do want to be transparent as possible at all times and share information that drives actions and share information that can help people take steps that they need to take to protect themselves or others. Sometimes the other competing principle is, protecting someone's privacy, health information privacy, et cetera. So in each instance, it's, I guess, a case-by-case situation as to what needs to be shared and with whom does it need to be shared in order to accomplish the purpose of making people as safe as we can and protect their private health information as to the greatest extent that we need to legally and morally and ethically. So I guess my answer to that question is, if there is a need to know and there's going to be a benefit to sharing the information, we absolutely will. And if it serves no purpose that could help someone take an action, it is likely we will defer to other principles as needed in a case-by-case situation. I don't know, Mayor, if you wish to answer that.
I think we're prepared to answer any questions specifically asked. So if you have a question, we would love to hear it. When we have been asked about our juvenile detention facility, for example, we have released information around the COVID patient there and the number of juveniles that may have been exposed as a result. There were 16 of those juveniles. We have released information about the testing progress with respect to those juveniles. All have been tested except for the one juvenile who turned 18 who did not want to be tested. So I think we have to work collaboratively, and I think it is helpful to us to get specific questions that we can then turn around and try to find information around. Suffice it to say that yes, there have been, I can surmise that there have been folks that live in homes and live in apartments that have contracted COVID-19. So if there are more specific questions, I'd invite you to submit those. We turn around hundreds of pieces of data every single day around a variety of information and have turned around that data swiftly. So, for example, just this week, a reporter asked me about a data set related to kids and their demographic information. That universe is extremely small, and it is time